You notice I got this thing, which is happy hour.
Okay.
I just wanted a shirt that was a happy shirt, and you have your robot love shirt. So there you go.
There we go. Yeah,
there you go. So there's your Tesla related thing for everybody. So yes, Scott and I are not going to talk about Tesla today or robots or anything. We are going to talk about cancer, and it's not going to suck. So stay tuned. Hey, y'all, it's Dr. Know-It-All. I am joined once again by Dr. Scott Walter, who is a very proud cancer survivor now. And we are going to do a little PSA, which cracked me up because I said that to my wife and I realized that's prostate screening antigen or whatever. So I was like, no, public service address announcement. Anyway, so Scott, tell us a little bit about, and for people who don't know, Scott has been on this channel a ton of times. If you don't know, you better watch some other damn videos. So anyway, so yeah, tell us, I don't know, tell us your story. We're going to keep this light so people don't get depressed, but it's important, I think, to listen to this. First of all, let's just start with that. Why is it important for people to listen to this?
Okay. Well, I think the first thing is that, this is going to be a PSA. And a few weeks ago, you had to do a video, which is called Cancer Sucks.
Right.
Because unfortunately, 2 people very close to you have come down with stage 4 cancer.
Yeah. And I've got this for my mom right here. And what is it? In the fight for someone I love. So yes, there you go.
And at that time, we were kind of aware of my status. So I've been diagnosed with cancer for about 18 months. And I didn't keep it a secret. I just didn't broadcast it. All my friends and family and everyone kind of knew about it. Right. And we were pretty close to being able to, let's say, have some very positive news. So here we're turning around, and that is cancer doesn't have to suck. And the reason is a couple of months ago, Cleo Abram did a video, said that we have a cure for cancer, and it's called early detection.
Right.
So this is the whole point. It's all about early detection. You get it early, you will be a cancer survivor, and you will go in your cancer journey, because everyone has a different cancer journey, can go from either being a walk in the park to being an odyssey.
Right.
Get it early, it's a walk in the park. In my case, I would say it's been pretty close to a walk in the park. I've been very fortunate. I haven't had to have this arduous odyssey that a lot of people have gone through because it was caught early. Now, not through, let's say, my actually being very proactive and looking at the early signs, which is why I want to talk about it.
Right.
And that if you're lucky enough to get it, and of course, John, you and I, we have another mutual friend, which we didn't realize that we actually both knew him.
Right.
He recently also gave us the good news that he is a prostate cancer survivor because it was caught early, and that his doctor said that after surgery they had such clear margins and everything. He is out of the woods.
Excellent.
Now, I may not be completely out of the woods. Let's just say this is the first time that when they went in to take a look, they said, okay, we don't see any recurrence, but we have to be vigilant. So we're hoping. But at this point, I was like, I'm not going to wait another 6 months or another 12 months because I want everyone to know how important it is. So early detection can be done a couple of ways. We can be hypochondriacs and we can go and get PET scans all the time.
Yeah.
Okay. That's impractical. In some cases, you need to talk to your doctor. They will be able to say what you need to do based on your age, family history, and everything else, and what's going to be appropriate. The most appropriate thing is listen to your body.
Right.
If something is not right, do something about it. In my case, I was getting the signals and I ignored it for 5 months until my body really told me. And boy, was I lucky that when it really told me and I had no choice, that it was still early enough stages. It was stage 0.
Right.
And it basically came down to, don't want to make too much light of it, but what was it like? Well, it was super easy. It was barely an inconvenience. Okay. So from my standpoint, I did not, it was no pain. It wasn't difficult. It just kind of impacted my schedule a little bit, preventing me to be able to travel, do everything else.
Well,
However,
before we go on,
a lot worse.
Before we go on, your story, how you discovered this all is really like quite the story. So I think personally it's more of a little bit of an odyssey than you're letting on. You're making this sound very easy. It was a little more. But anyway, tell about how you discovered this, because it's kind of wild. And I think there are a lot of people in this audience. I have looked at the demographics. The largest age group that watches my channel is 65 plus. But honestly, Lance Armstrong was in his 20s, regardless of what you think about his drug usage. He didn't listen to his body, and he had testicular cancer that almost got very, very bad. So so tell your story about not listening to your body at first and then being forced to.
being, let's say, very, very lucky in the end. So I know exactly the day, and part of things is what I've decided is that because I'm lucky, is my best thing is go out there and evangelize and tell everyone in my demographic, my cohorts, my age, lot of my friends that you've got to look for some specific signs. And
Right.
my sign was on exactly the 20th anniversary of September 11th. I
Right.
had blood in my urine,
Okay.
just a little bit. And of course, it was a bit shocking when that happened. And now, did I tell another family member? Did I call my doctor? Or did I Google it?
Right. You Googled
I
it.
Googled it.
Yeah.
Okay.
Yeah.
And if you look at it, the first thing I learned from Googling it is that I now know what the Latin is for blood in the urine. It's
Right.
hematuria. Okay. There's two forms of hematuria. There's gross, which is exactly what it sounds like, and there's microscopic, or some people might say major and minor.
Right.
In one case, it's very clear. You can see blood in the urine.
Right.
If it's red, basically get it checked out.
Right.
And then the microscopic is that there is blood in there. You just can't see it, and you would need to do a test. And that's why I
Right.
would say anyone once who is doing an annual physical, make sure they do a urine sample and they do a blood test. It's very simple. It's a little dipstick
Right.
they put in. They can check it out, and then you'll know. And you'll read in Google what's going on, and
Right.
it's like alarm bells. Seek medical attention. It could be all these different things, but way, way, way down the bottom, there is the out clause. It's like, it may be nothing, And so I would like with it's nothing. Next day, nothing,
Right.
and then Columbus Day, the next time it happened. But I had been very vigorously walking and stuff like that, and so I came
Right.
up with my sort of rationale on why isn't there, because no one really wants to know. And then that was just a one-day thing. Thanksgiving, same thing. I mean, I'm
Right.
hitting the holidays, right?
Yeah.
Christmas comes
Jeez.
around and like nothing. It's like, oh, I'm out of the woods.
Right.
Come in January, absolutely nothing. And then on a ski trip, and at the end of the day, came in, realized I had not emptied my bladder the whole day, and I
Oof.
went to empty it. I went from blood in my urine
Oof.
to urine in my blood.
Oh.
I passed probably 500 milliliters of blood.
Oh, jeez.
So yeah, now it wasn't, let's say it was shock, but there was like no pain. There was like no indication. It's not like I had to pass a kidney stone or anything like that. I was just like, oh my goodness, what's this? So it's very
Right.
clear. Had to seek medical attention. They had
And
to
at the time
irrigate me.
you were in
Yeah.
Zermatt, right? You were in Switzerland.
In
So
Zermatt,
yeah,
yeah, in
yeah,
Switzerland.
yeah,
Healthcare in Switzerland is remarkable.
yeah.
It's and they did a very good job of taking care of me. And it took 2 days of irrigating before they could go in and actually see what the problem was, because
Wow.
you need to clear it out. And then when I went in with a scope, immediately they saw ein grosses tumor. And my German was good enough that when I heard that, it was like, oh.
Yeah.
And that's when the realization kind of comes in. Now, it doesn't necessarily mean it's cancerous.
Right.
Could be tumors there for other reason, but my brother had passed away a few years before from cancer. He had bladder cancer also,
Oh my
and
goodness.
prostate cancer. He had two cancers at the same time.
Wow.
And unfortunately, the prostate had metastasized to the bone before they had caught it. So he declined very, very quickly.
Right.
My mother passed when I was 13 from breast cancer. I never met my aunt on my mother's side because she died of breast cancer before I was born. My cousin Judy died in her late 40s from ovarian cancer. So it was like, it was running in the family.
Right.
And so it was like, it was pretty clear. And that's when you kind of, a lot of things change, your thought process of what's going on,
Right.
of what you should be doing. And, do you have the mental fortitude to go through this? Because, if no one wants, you just imagine it's the Odyssey. And the point here is it
Right.
doesn't have to be like that. Okay.
Right.
So I'm imagining the worst thing. I'm imagining all the chemo, everything else, having body parts removed, a lot of different things, loss of function, everything else. None of that has happened. I've been very, very lucky
Right.
that I have not had to go through that. And this is the thing why I want to point it out is early detection. You don't have to go through that. Now,
Right.
Hank Green is going through it right now. And for, it's not like all cases of cancer caught early are going to be a walk in the park
Right.
because, but he's had a history of it, which is why they were looking. And so he was not surprised that he had it. It was almost like they were expecting it was going to happen someday. So
Right.
he's had to go through it. So anyone's going through it, it's worth getting it from his perspective and understanding. But I want to make sure that when people see that, it doesn't make them so scared that they, oh, cancer is like Schrodinger's cat. So
Right.
long as I don't open the box, there's a 50% chance I don't have it.
Right.
Okay, don't do that. Now, as soon as I get kind of the good news, a day later, I'm crestfallen to see the news coming from Dave Lee that his wife has breast cancer.
Yes.
And that hit the Tesla community very hard. However, there's a lesson to be there. First of all, that's again, early detection. She noticed it herself. What did they do? We'll wait till we get back home. No, they went in and they got it checked out.
Yeah.
And because they have taken that steps, I'm very hopeful that her results are going to be very, very positive. So go in there, get it done quickly. You'll be okay. So I ended up being lucky that once they stabilized me and then they had to do an operation. And of course, the first thing that steeled me in the whole thing was just thinking about, your family is like, my kids, one of my kids is getting very close to graduate. Was I going to see that? All those things. It's like, you want to be able to see those milestones that are coming up.
Right.
The other thing is I was like really pissed that it's like, does that mean I'm not going to see Starship launch?
Right.
Am I not going to see us go to Mars? So suddenly it went from like, do I have the toughness to do this to like, there's a great future out there. I don't want to miss it. I want to be able to see that as well.
Right.
So, you're hopeful that everything's gonna be all right. And then the operation, so it's bladder cancer, and it's amazing how they're able to remove it. I've had at this point 4 operations, and not one scar. So I'm like, I can't go to the beach and like, hey, check out, I don't have anything like that. So it's kind of disappointing.
Right.
And they're able to use the opening provided by nature, basically, to go in there and scrape it out, which is just remarkable. That it's a miniaturization able to go and do it. And fortunately, that when it was done, he was able to say that, hey, that's it's stage 0. It was very good. It was on there, felt very good, and then gave me a type of treatment after that should clear it out. But the problem with tumors, especially in the bladder, it's like dandelions. You pull them up, you get the roots out and everything like that, but then the seeds spread.
Right.
So there was a possibility of recurrence, and there were different recurrences, and I had to go through treatment. First, immunotherapy, which evidently seems to be very good. Certainly actually fighting against COVID, because I was exposed to several people who had COVID who shall not be named while I was under treatment, and I did not come down with it. And it turns out it's this thing called BCG that ramps up your immune system, that evidently is believed that could steal your immune system against things like COVID. And it seems to have worked for me. And it slowed the cancer down, but it didn't knock it out completely.
Right.
And then so after 2 treatments of that, and then follow-up surgeries, then the last dose recently, which was not BCG but gemcitabine, which is actually a chemo, but it's not as bad as it sounds, because they did not put it into my veins. That's why I'd say it's like I did not have to go through the classical chemotherapy where you lose your strength, your hair, you vomit, and everything. No.
Right.
This is like 1 day a week for 6 weeks. You go in, they reverse the flow into your bladder.
Right. I think you said you had your oil changed. Wasn't that you said?
I referred to it as an oil change. Yeah.
Yeah.
So the basically all I had to do was hold it in for 2 hours, and that would be it. And you basically rotitionize yourself, is that you hold yourself 15 minutes at each side to make sure it gets all the surfaces in there.
Wow.
And that's it. And that's it. So that's what I'm saying. It was an inconvenience. I never had a temperature. I never vomited. I didn't lose my hair. I didn't do anything like that. Okay. So the only thing it did is that if I had got a ticket to the shareholder meeting, I couldn't have gone, because if they had the shareholder meeting on a Thursday, it would have worked. But my oil changes are always on Monday, so I couldn't do it. Okay. Yeah. So actually, I was really happy I didn't get an invite to the shareholder meeting, because it's like, oh, okay. I mean, so that's it. All right. First world problems here. All right.
Right.
But
Right.
the point is, I want everyone to really understand cancer doesn't have to suck. As a matter of fact, to give you an example, when I told one of my friends, he was like, so happy about that. It says, yeah, both you and I are cancer survivors now. And he looked at me
Right.
like, what? What are you talking about? I didn't have cancer. I was like, yeah, you did. A couple years ago, you had some moles removed from your skin
Right.
that turned out to be cancerous. Oh, that was nothing.
Right.
Yeah, but it would have been nothing if you
Yeah,
hadn't done anything about it.
exactly.
So again, this whole idea is we can cure cancer if we catch it early. Check
Right.
the signs. If you see anything on your body that looks like it's a mole from, sun damage or something like that, see a dermatologist and they can remove it. If you wait too long, then cancer will suck. But
Yes.
again, cancer doesn't
Right.
have to suck.
And I'm not stealing your thunder at all here, but just adding to it that my wife, skin cancer, the surfing hippie skin doctor, I tried to get him to like just come on and do a quick PSA, but I don't. If he does, then I'll just insert it here. But anyway, skin cancer is the easiest one. You just have to go to the dermatologist. They look over your body every 6 months or a year, depending on how old you are, and they give you the clean bill of health, or they take the nitrogen out and blip it, or they cut it, or my wife is actually I just asked her, I said, she's a 4-time cancer survivor because she's had 4 Mohs surgeries now. And that's the kind of surgery where they discover if they find an actual cancer that's grown. She's very, very fair skinned. And, even though she's in her 40s, it's the kind of way it goes anyway. But what they do is they cut it, they test the edges, they biopsy it while you're under surgery, then they cut out some more and they keep going until they don't see any cancer anymore. And then they sew it up. So walk in the park again. You don't have to go to sleep. You're awake.
And did
It's
she
local.
see herself as a cancer survivor?
No, she didn't until today. I just told her that. And she was
Until
like,
you
no, I'm
mentioned
not.
that.
Yeah. She's like, no, I'm not. And I'm
Exactly.
like,
Exactly.
four times you are.
4
Yeah.
times. And the thing is, it could have turned out a lot
Oh,
worse.
yeah.
So early detection. And the thing about bladder cancer, it's very common in men and women. So it doesn't matter if there's a little bit of blood, get it checked out right away. And if
Right.
it turns out to be something else, oh, well, that'd be great. At least you won't have that worry.
Right.
So get it done very soon. I basically put my head in the sand for 5 months, and I was
Right.
lucky that it turned out the way it was.
Yes.
Because at that point, if it had gone a little bit further in, then rather than basically them kind of scraping it out, which is all they had to do, very surface,
Right.
they would have had to gone in there, and then it becomes a bit more serious. And then
Yes.
you really start talking about possible loss of function.
Right.
And then at some point, possible, truly radical surgery where they are removing a body part. And now you're talking about a real change in lifestyle.
Yes. Yes.
So it's a very common, but it's very, very treatable.
Right.
And in some cases curable. Now, I don't know if I'm cured. All I know is that the treatment is such that I'm not, basically maybe it's a Bronto rock that finally takes me down, and not bladder cancer at this point. Okay.
Right.
And so let's make sure that's everyone's outcome, that the possibility is what gets you is a Bronto rock. And if you don't know what it is, remember, don't look up.
Right. Yes, exactly.
So that's my view. Everyone knows it's a Bronto rock that's going to take me down.
Yeah.
It's not going to be something like bladder cancer or anything like that, because we can all be fighters, and we don't. I've never really thought that this was a fight. This wasn't even a skirmish. Okay.
Right.
For some people, it has had to be, and in some ways, one of the things that steeled myself is I asked myself, "Am I tough enough to do this?" And then one of the things I thought, well, Haley Arsenault went through something way worse when she was 8 or 9 years old.
Right. Right.
She lost, the partial function of her legs. I don't know if it was a partial amputation of her bone, but in the end, she turned out pretty well, and she was able to do it. And she was pretty tough. So again, these survivor stories sometimes is what gives us strength, but at the same time can make us so afraid.
Right.
Oh, could I do what she did? Could I go ahead and do that? The answer is you don't have to if you catch it early. So go ahead and check out the signs.
And I will again chime in from personal experience that's going on right now. Which is one of the reasons why it's difficult for me to talk about this too. But my mom, her classic line always throughout my entire life was, she was like, "I'm just like Scarlett O'Hara, talk to me about it again tomorrow. I don't want to know about it today." And so she had a lot of signs of ovarian cancer that were there, and she just ignored them, ignored them, ignored them, ignored them. And when she finally went in, they were like, oh, and the problem for her is that they thought they did a surgery, but what they discovered was it had metastasized. So
Yeah.
it's substantially worse problem now. Is she is in her mid 80s. And so that works to her advantage because of course your body's not as, it doesn't reproduce the cells as quickly. So she has a reasonable chance of it doing well. The other thing about this, I just want to say, and I've talked to several oncologists, cancer doctors who have been very kind to reach out to me since I started talking about this. And the chemotherapy, the therapies that are available now are so much better than even
Mhm.
5 years ago. I mean, it's just incredible
Yes.
the
Yes.
levels up of this stuff. Yeah.
Yeah. And actually, we can throw in an AI twist here.
Right.
My next door neighbor, his son, unfortunately, was diagnosed with two cancers in I think his late 40s,
Right.
lung cancer and brain cancer, and he's a
Ouch.
trainer and he's never smoked in his life.
Wow.
And it was like stage 4. It was pretty serious.
Right.
But they then did a genetic survey, and because he has like these certain gene types in there, like certain mutations on there, they know exactly what therapy will work. And they know which
Mhm.
therapy is going to work because the AI is telling oncologists nowadays this is what will work because there's a big enough database of all the treatments and what's worked. They're able to do it. And it's remarkable. They've
Yeah.
given the treatment and it has reduced to almost the point they can't detect it. So what were
Wow.
very large tumors have almost disappeared to the point of not
Right.
being there. So it is very hopeful. Now, this does not mean, oh, let's just wait until it gets to
Yeah.
stage 4.
Yeah. Don't do
No,
that.
because
Yeah.
trust me, he's having an odyssey right now.
Right.
But of course, it was a big shock because he didn't have any of the risk factors. He definitely wasn't of the age or anything like that. Generally healthy, and then suddenly some weird decline on something like that. So
Right.
it can be taken care of. We all know our bodies. We all know when something is not right, and if it's not right, get it checked out.
Yeah.
So yeah, your
I
urine should be
again,
yellow. If it's
yeah.
red, go
Yeah.
immediately and have it checked.
And just in general, anything. I mean, if you the problem is I'm just like you, I'll have something weird happen to me and I'll be like, ah, it's gonna be fine. There's just some funky weird thing going on. It's like if it's outside of the envelope of like, oh yeah, I pulled my muscle because I went to the gym yesterday or something, that it's like ignore it. But if it's anything weird, you should have it checked. Definitely, especially as an adult, please go to the doctor and get a regular physical. I mean, because they do blood work, do the blood work. Don't go to the physical and ignore it and not get the lab drawn because, they do PSAs and all, which is prostate screening antigen in this case. Anyway, but they'll do blood work, which can tell you if the white blood cell count is up, if the PSA count is up. A lot of the stuff they can detect just from things like that without even having to do any kind of, CAT scans or whatever.
Oh,
So
very
yeah,
yeah, very quickly. Yeah. So usually that's what they'll do is they'll do that before they do something more invasive.
right,
So in many cases may not be able to know 100% unless they take a peek. So in my case, I've had a couple of PET scans, and part of the reason for the PET scans is to see if anything had metastasized.
right,
But they actually can't see the tumor inside the bladder because it gets blocked from the PET scan. But they were looking for anything outside to be able to
right,
tell.
right,
The only way they could tell from that is, first, like, well, yeah, you get blood in the urine, which could be a bunch of things
right.
that they would need to check out. And the only way to know for sure is they have to go in with a scope to take a look.
Right.
And it's more of an unpleasant thought than anything else.
Yeah.
It's not as bad as you think. It's
Right.
not as bad as you think. It's not something that, in the end, I kind of joke, me joking. There are two kinds of men, those who've been to a urologist and those who will.
Yeah. There
Okay.
you go.
So it's just, and that's just kind of how it goes.
Right.
And it's really, it's not that bad. Don't make yourself so scared or worked up over what it's going to be like. You can do it.
Yeah.
I'm basically a wimp when it comes to a lot of things. So if I can do it, you can do it.
Yeah. Yeah. There you go. I think that's the long and short of it. Get your body checked out. If you skin is easy. If you see something that looks weird, I think it's like as big as a pencil eraser or larger, irregular shape and ugly, basically go get it checked out like immediately.
Hmm.
Um,
Hmm.
because if you catch it while it's on the skin, they can just cut it right out. If it metastasizes, you are in for an odyssey. But
Yes,
also don't
exactly.
be scared. Whatever it is, like, don't be scared about it. It's better to find out and take active steps. Be an agent in your life, not passively receiving things. I think
Yes,
that's the
I
way to
mean,
think about it.
you can whenever cancer happens, it's always an inconvenient time. It's like
Yeah,
now of all times. I mean, couldn't have waited till, next week or 3 weeks from now or something like
right,
that. It's
right,
no matter when it is, it's going to be inconvenient. The
right.
longer you wait, the more inconvenient it's
Yeah,
going to be.
yeah, that is true.
Okay. So just get it taken care of when it has to be done. People will rally around you. The other thing is a lot of your friends it's going to be tougher on them than it's going to be on you. A
Mm,
lot of them aren't sure what to do, whether they should talk to you about or something like that. I'm very open. I just tell them, look, I have no problem. And then they're like,
right,
oh, I don't want to bring it up, or maybe I don't want to talk because, I'm afraid of bringing it up. For the most part, I have to find it's like, is it okay if I talk to you guys about it? Or are you sick
right,
of hearing from it? If you don't want to hear about it, you don't have to. But if you ever want to know the status, just bring it up and I'll talk about it. So a lot of times that's kind of happens is that everyone's sort of afraid what's the best way to do it. And the best thing to do is just to let everyone know what the ground rules are because
right,
no one quite knows because some people don't want to talk about it.
right,
And they really want to keep it secret and others are not. And again, I was very open to everyone within my community that's known. All the YouTube hosts have known.
right.
Um, but it's just not something we've decided to broadcast at this point because we think it is because it's a story that hopefully is going to help save some lives.
Right. Exactly. Let me ask you this question really quickly, just for people who are watching at this point. Like, if people write you in the comments or message you on Twitter or something, will you respond about that? Like, if they have
Oh yeah,
questions?
oh yeah,
Okay.
yeah,
Okay.
yeah. I have no problem. And
Yeah.
again, it's like one of my friends, a colleague of his, was very young and suddenly was going through it as well. And he reached out to me and says, I've got this friend and he's having a hard. Can you talk to him? I'm like, "Yeah, absolutely. I mean,
Yeah.
as soon as it happens, there's always someone because the reality is there was another friend of mine that had just gone through it
Right.
and was getting very close. And I was like, before I was diagnosed, it was like, yeah, so yeah, but the blood in the urine thing, is that something to be worried about? And then, then I kind of was like, oh, there's a possibility. Should I get it checked out? And I didn't. And then when it happened, the first thing I did, I was messaging him
Right.
right there in the ER. And he was sort of telling me what to expect and
Right.
was able to kind of get me the strength to go through. And then part of it is we were just able to, it was very jocular back and forth. We are just making all kinds of jokes.
Right.
Um, you know, because do you want to get down to it? Here's the joke section. So if you made it this far, are you ready for the
Yeah.
jokes?
If you've gotten this far, you deserve a joke.
Okay. So we all know what a catheter is if you don't look it up. so so basically it's like whoops, time of that because they basically had to irrigate me and that
Right.
means they had to put something in there and that's something that absolutely no one looks forward to,
Yeah.
especially a male. And he's it's like, okay, so Victor, what do I do? But I says, well, um make sure he uses the good stuff for the that's supposed to this is like a numbing agent. Make
Right.
sure he's using the good stuff. And I'm just like, how do you bring it up at a point like this? It's like, hey doc, you using the good stuff? And he's gonna say, yeah, I don't know, let's find out,
Yeah.
you know,
I'll
and
know
then
once I start pushing. Yeah.
yeah, exactly. The other thing is like, I'm thinking it's like, you realize that for every urologist out there, there was a penis that was the first time.
Right. Yeah.
And the question is, you know, did the patient find out? No. Um, Before or after or during,
Or during. Yeah.
you know, Jesus Christ, doc, this hurts like hell. This is your first time. Yeah. How'd you guess?
Yeah,
You know,
exactly.
so,
Yeah, that's a maybe
I
that's
was
a
just,
reason why you don't want to do the first one at a what are those called teaching hospitals, because then
teaching
you
house.
get the resident who's like, I've never done this before.
Yeah. And yeah, exactly. So, it's, I mean, in some ways, you need a little bit of gallows humor to make it through.
Right, right,
Because it's all about attitude and of, you know, hopefully this hasn't been a downer. We want it to be the other way around.
right,
Um, I made light of everything going along the whole time. And the reason is that um, you do not want to be afraid of cancer.
Right.
And in my case, I wanted to prove to cancer I was not afraid of it by laughing at it in its face,
Right.
by being open. And a lot of times, humor and laughter and everything else can go a long way to changing your attitude, to knowing that you're going to do it, you're going to beat it, and those around you will. It's just going to be easier on them as well. So
Right.
sometimes that's the way we are able to handle situations that are pretty bad, is just throwing a little bit of humor.
Right.
Um, Hopefully tasteful. I never know whether I've crossed the bounds or not,
I
but
don't know. Tasteful might not even matter. It's cancer after all. So,
yeah, yeah, yeah.
my wife for my mom got some socks for her to wear around the house that I can't say this word. I probably can say it on YouTube, but anyway, it's F cancer. So it says that
Yeah,
across the sock. So you got to have a
exactly.
little attitude with it. And
Yeah,
by the way,
yeah.
just to tail onto this, just as I'm experiencing this as a person who is dealing with people who have cancer, it I think you have to respect whatever the person wants, as you said, Scott, as you said. But if they're willing to talk about it, don't ignore it. like
They want to.
bring
They
it up,
want to.
talk. Yeah, 'cause they'll want to. They can answer questions. They may want to just have a hug or something. Who knows? Good gracious, just whatever that is. Just sort of read the room. I'm not good at that. And figure out what these people need for support, whether it's food or a hug or a conversation about things or just being with, just go over to their house and just sit with them and read a book or watch TV for a while. Sometimes
Yeah,
that makes
yeah.
people happy. So yeah,
Yeah, exactly. And again, if you look at some of the videos that Hank Green put out there, he had one sort of talking about that. What's the best thing?
right,
Because no one's quite sure what are the do's and don'ts, what are the taboos and everything, and everyone's
right,
going to be a little bit different. And sometimes that you know the person, and maybe you have an idea of what they are. Are they very very stoic? Are they very open? You can sort of see how their mood has changed, but just ask them what it is you can do, and what the boundaries are, and maybe they'll let you know.
right,
But
right,
I think the best thing is that to do it from my side, so I don't have to put them through it, because
right,
again, you will probably find out that it's the people closest to you are probably having a more difficult time than
right,
you are.
right. Yeah. Yeah. Because I guess, I think that's what my mom said. She was like, "Oh, this is easy for me. My job is to live and fight this. Everybody else's jobs is like, what is our job?" So,
Right.
it's more complicated. You don't exactly know as a support staff exactly what you're supposed to
Right,
do.
right, and part of it, again, this is something that Hank had brought up, is that a lot of times when the diagnosis is there, is everyone is suddenly there immediately with words of good wishes and everything like that, but then like a couple of weeks go by and like everyone's gone,
Yeah.
and so he suggested what you should do is like, oh, okay, um, you know do something right away, but don't visit for a couple of weeks,
Yeah.
because
Yeah.
and then maybe coordinate with other people to say, okay, who hasn't been, I'm going to go, it's going to be my turn. So
Right.
kind of work that out so that they know that you're always there.
Right.
And certainly a lot of my friends have been like that. They've always texted. They always want to know what's going on, give them the updates. And
Yeah.
again, it doesn't hurt to talk to someone who maybe have gone through the same thing. And once you've gone through it, is pass it forward.
Yeah. Yeah. And but it's I'm going to be driving up next week to go sit with my mom all day Tuesday while she gets chemo, and then for the days afterwards to support her through, because of course hers is much more of an odyssey than yours, and she is having to do,
Yeah, yeah,
general
exactly,
chemo. So
exactly. I mean,
yeah,
that's very tough, especially at her age and
yeah,
everything else.
yeah,
So again, it's like, I'm not trying to, belittle what everyone else is going through.
right,
There's a lot of people that are going through it, and I sometimes wonder whether I would have the fortitude to do what they're going through.
right.
And the best thing is to make sure there are fewer people that are going through that, and that's why
Yes,
nip it in the bud,
yes,
get it early.
yes.
Yes.
So number one, listen to your body. Your body's probably
Hmm.
going to tell you something's funky. Number two, go to the doctor regularly. And number three, if you're over 30 or 35 years old, you should be going to the dermatologist. At least talk to your primary care
Right.
physician about
Right.
when you should start. Because, especially the fairer skin you have, the more likely are to have skin cancer early.
Yeah.
So there's
Yeah.
there's there's many different ways your body can mess up. And yeah, so just pay
Get
attention.
it checked. Yeah, yeah.
Yeah.
Get it checked out. And again, put together a plan with your doctor,
Right.
to talk to them. They know your history and everything else and what your risk is and what they should actually be doing and checking for. I was a bit surprised with one of my friends I talked to. He's pretty healthy and everything else, and he always gets the physicals. And I told him, it's like, are they doing a urine sample every year? And says, no, my doctor doesn't. I was like, what? I said,
Yeah.
you're getting a urine sample and he's checking.
Yeah.
Just tell him to
Yeah.
put it in there because it's a little dipstitch thing. And if he says, oh, because it's not covered by insurance, like, don't worry about it. It's probably like a $20 check.
Right. Exactly.
So just
Yeah.
go ahead and because I suppose if you really are good at it, you might be able to tell looking at the color of your blood that maybe
Right.
of your urine that there's blood
Right.
in it, but not really. I mean, it depends upon whether you had asparagus the night before or vitamin
Yeah.
pills or something like that. Your
Yeah.
color is all over the place.
Yeah.
So the only way you
Well,
can do is with a
I was
test.
able to discover just from the smell of my urine that I was starting to get pre-diabetic because it was just like, nope, that doesn't
Yes,
smell right. So,
think I
so
think they say the same thing too. Is that you
yeah.
may notice an odor change or something like
Yeah.
that, and if you
Yeah.
do, that might already be kind of a key. If you're seeing something like that, it might be a sign to get it checked out.
Yeah. So pay attention. Do not be an ostrich. Don't stick your head in the sand. Even though ostriches actually don't stick their head in the sand. That's
Heads in
just
the
a
sand,
myth,
yes,
but it's a good metaphor. So don't do that.
yes,
Pay
yes.
attention, get it checked out. Don't hide. You want it, like you said, you want it to be a walk in the park, not an odyssey. So thank you so much, Scott. This was a little difficult for me because of the timing of it all. Of course, it's inconvenient, right? It's always bad
It's
timing, but
always
yeah.
inconvenient, but
But anyway, this is wonderful. And I really appreciate you opening up about this. And I honestly, the outcome that I'm sure you want, but I also want the most is for somebody 6 months from now to go like, oh my gosh, I watched your video. Something weird happened. I got it checked out. It was cancer. They were like, no problem. It's done. That would make
yeah,
me
but
incredibly happy.
and to show you like the kind of inconvenience that won't be too fun if you just want to go into is that my second surgery, my son was down here, and it was on a Thursday, and we had never gone to a Stanley Cup game before,
Right.
and there was a semifinal game of the Lightning against the Rangers on Sunday.
Right.
And like we were going to go, so we
Yeah.
got the tickets. So like one of those bucket list things.
Yeah.
Some like
Gallows humor.
dark humor. It's
Yeah.
like, oh, better do it now or never. And the thing is, after surgery, you actually have a catheter and a little bag you got to run around
No,
with.
jeez.
So I told the doctor, I said, I got tickets for a hockey game on Sunday. Can I go? I said, oh, sure, no problem. We'll get you a travel size pack. So
Jeez.
I had a travel size pack, strapped to my knee just to make sure no one was going to know what's going on. But
Right.
of course, those things fill up pretty quick.
Right.
And then I realized, like, oh, after the end of the first period might be a good time. I realized, no, it's a really bad time
Oh,
because
yeah.
like everything is full. So I
Right.
waited till exactly the middle of the second period. The Lightning are down like 2-0 at that point. So, oh, it's a good time. So I go in there, have the whole men's room right to myself, just because it won't freak anyone out that this bag is like got stuff coming on out of it.
Right.
And of course, that's when they scored the goal.
Right. Yeah, of course.
Yeah. So,
It's like, come on.
I go back and I was standing around. I take full credit. I take full credit. It was only because of me that I went in there that they finally get the first one on there, and they went on to win 3-2. So it was a great
Nice.
game.
Nice. Great game.
Yeah.
Wow.
So
Very exciting.
it can be a little bit inconvenient, and you can get some real funny stories out of it.
There you go. And that's what you want. You want to be sitting around talking to your grandkids someday, laughing about these things,
Yes.
later on. So
Yes.
that's the
Yes.
ultimate goal is
Yep.
survival. So there you go. And
Yep,
quality of life
exactly.
and quality of
Yep.
life. So,
Yep.
yeah.
So it doesn't have to impact you. You can still do things. Yep.
Right. Okay. Thank you. Really appreciate it. Any last words you want to wrap up with? I guess I'll let you say goodbye for today.
Oh, wow. Well, I hope we found this fun and enlightening and that you learned something new. And please like and subscribe and all that. But more important, rather than like and subscribe, please get checked out. That'll be more important.
Absolutely. All right. Cheers, everybody. See you in the next one, which I promise will be about Tesla or robotics or something like that, not about cancer. So bye-bye.
Cheers.